Okay, we're going to go ahead and get started today. Thank you for joining me again this week for the classroom training and support meeting. I appreciate all the time you're giving me June and July as we begin our plans for 2020-2021 school year. We have had so much to do and talk about, and I wanted to keep you up to date. Today, we're going to talk about an overview of some of the coaching supports and new documentation that we have been discussing with your coaches. We're going to have a review of all of our pilot data, which is really exciting, from the family child care to our Louisiana leaders to CACFP, LDH partnerships, shared services. We're going to talk about a survey that we're going to be doing about COVID-19 and your reflection, and then kind of what's next as we begin our meetings and doing things virtually. What will be next on the agenda? Again, I wanted to stress as why we're making these changes in deliverables, why we're looking at coaching, why we're looking at curriculum. We know that all children need to enter kindergarten ready to learn. And in order for us to reach this goal every day, the children birth through 5 in Louisiana need a classroom that is sensitive and warm, is organized, engaged language and interactions, and has high quality interactions and instructional tools. And we know that you are the key to making that happen. You are in centers every day. Your coaches are in centers every day. You know what's happening in the field, and we hope that you are our eyes and our ears to seeing improvement and assisting you to make sure that children are ready to enter kindergarten, ready to learn. Coaching supports. That's why we started the coaching supports. We felt that we needed to start some kind of supports for coaching. So we started with our last meeting. Well, actually, we've had 2 meetings thus far. So our last meeting, the coaches reviewed the research-based coaching model. We talked a little bit about observations and how to do an observation with intentionality. We identified different classroom support types. We explored the components of high quality research-based coaching, and we learned about the new coaching forms that they will use and utilize during their site visits. And I'm very excited to say that I have gotten lots of emails from your coaches. I'm very excited that they're really glad to be getting these supports and are looking forward to every meeting. We focused on and reflected on the current practices, how we have mentoring, that we focus on personal outcomes, and it's not necessarily programmatic outcomes, it's a relationship, and that how coaching needs to be mentoring and programmatic outcomes to see change. And then we focused on the difference between coaching and technical assistance, with technical assistance being just that one time that you go into a center to provide assistance. We talked about our coaching template and our map, and we've gone through prior to the initial visit, the on-site visits, the welcome visit and relationship building, and then the observation. And next meeting, we're going to talk about joint planning and coaching and things moving forward. There is one thing that we have asked on our deliverables this time is about the ECAC. As we know from your data that you reported last year, and every area is just a little bit different, but what we're seeing is we have about a third of centers that are not enrolled in ECAC program, a third that are in progress, and a third of the teachers have this. So we're asking that each coaching and technical assistant visit that your coach verifies or gets an update on whether the teacher has an or ECAC or whether they've started an ECAC program. Um, if not, if you can make sure that the director has the staffing map, and I've linked it to this presentation, and I will forward the presentation after this meeting to assist in the teacher's progress. and then targeting centers that you know have not started and helping them with the enrollment process to get their teachers enrolled in the ECAC, and promoting any kind of ECAC programs when your start date on your social media, in your newsletters. We want to make sure that your teachers in your areas have access to the ECAC program, and then we need updates periodically. So it's really important that they ask that question when they go in for their visit with the teacher or the director. You said that this teacher, and this teacher have enrolled in the program. Are they still enrolled, and how are they doing? And now I'm turning it over to Dr. Susan Clark, who's going to give you an update on our family child care pilot.
Thanks, Michelle. Hi, everybody. Happy Friday. I know it's been a long week, but I'm really, really excited to just share information with you all. Came to you all a little bit earlier last year, and we talked a little bit about just the importance of really working with family child care. And we shared that our overall vision is to really start to think about how do we incorporate family child care in our statewide early childhood network. And we've used this pilot as an opportunity to really re-engage, to approach issues of access, and as we think about how quality, and as we think about how do we really diversify our landscape and our portfolio of offerings for the children and families of Louisiana to include family child care. We know that with that, we have challenges, and some of those things are, again, just nationally as well as in our state, we've seen a decline in the number of registered and certified family child care providers. We know that we've gotten a little bit better with this over the course of the year, but definitely there's minimal understanding what it looks like when we talk about quality of care and education in family child care. We've identified that we do have minimal levers to really support and enhance the quality of overall family child care, and then same thing with support. But we do know that using some of the information from our food program, the CACF program, that there's a wide range of providers who are operating and that do exist in the state. But the way we approach it is kind of sort of a one-size-fits-all model. And so we've used this year, and I'm happy to announce that we've had the opportunity to expand as we think about 2020 and 2021 to really use our pilot as a way to, first and foremost, reestablish and re-engage the relationship we had with family child care providers. And then to help them form and develop a family child care network where we really have taken the time to learn about the providers as individuals, to really see how collaboration has been so beneficial, to think about how we can improve the quality of care that's being offered, and then to really to use all this information as a tool and a resource as we think about how do we develop policy that directly affects family child care providers. And all the lessons that we've learned during this pilot and that we will continue to learn, we are using strategically now as we really think about what does this mean long-term for family child care providers, and as we develop strategy moving forward. So just a little bit about the pilot and overview is over the course of the year, we've learned specifically going to the field and working with our R&Rs and the providers who've been a part of the pilots. This year we had a total of about 37 providers in those two regions, working with VOA and working with Children's Coalition. And the providers are wonderful. They participated in observations where we used class and thickers. They did receive and participate in one-on-one coaching. They got professional development and support as well from our mental health consultants working with Tulane. They were in attendance with Family Child Care Network meetings that was hosted and facilitated by our R&Rs. And then they also participated in counting and reporting the number of children by funding, of course, would be our CCAP and our funding system, the kids that were enrolled in their program. And again, for their participation, because we know that this has been a different approach. We know that that family child care providers have not always been right at the forefront. So to re-engage with us and to take a part of our pilot, we did offer them stipends that were paid out quarterly for being a part of all these things. So during our pilot, we worked with Volunteers of America and Children's Coalition, and I'm happy to report that they were able to maintain and hold on to these participants. And this is just a little breakdown of what it looks like to actually be in the pilot. And as our pilot operators did this is some of the great progress we're glad to share is that for the coaching, we've seen over 18,500 minutes with Volunteers of America and over 12,000 providers having coaching from our Children's Coalition area. They held about a total of 16 to 20 Family Child Care Network meetings and trainings. And again, one of the things we found was we were really, really excited about the ECAC program, but when I say we really do listen to our providers and our partners, our R&Rs that worked with us, we really saw that while we think this is a great step, we really wanted to work on rapport building and really saying, how could we really just educate and orient our family child care pilot participants to what we mean by the ECAC program, what it looks like. And then some of them just were frankly just honest and say, we think that this is awesome. We think this is wonderful. We really appreciate the opportunity. However, we really want to take time to really dive all the way in with the coaching and really understanding the mental health consultants. And so while we only had 2 enrolled for the program, we had an overwhelming and resounding feedback from them saying that, could we continue this? If we go into year 2, is this something that maybe we could add on? And so a little bit of our progress when we look at the fall scores of class, there was a range of interaction among the providers, which again shows us that there was a need for differentiated coaching. And again, just like we see in centers when we started out using class, that there was a range. This is very similar to what we saw in the Family Child Care pilot. Can you go to the next? Okay. When we looked at the breakdown of our scores, family child care participants tended to score lower in the instructional domains of class tool, specifically the instructional support and engaged support for learning. And again, we know that that's kind of sort of on the higher level sometimes. So we take advantage of the low-hanging fruit, but then that gives us a direct spot to really think about as we move forward and we really engage in supporting our family child care providers more. This also gives us a good indicator of where we could be hitting the mark, what we can be working on. When we look at our overall class scores, like I said before, it's very similar to what we saw with the average class scores in 2015, 2016, when we had the first year of class statewide in Louisiana. So that was really exciting for us because that meant that while we haven't engaged providers as much or we hadn't used this measure of quality this first year, we were somewhere close to what centers had. And just like we can see over the course of these years with structured support, with targeted coaching, with the work that's been done, with an improvement process, with intentionality and purpose, we've seen steady increase. We're really, really hoping that if we can sustain and we can keep offering these types of supports, that we will also see the growth just like we've seen in these other aspects in the school and the early Head Start and the child care. Hopefully our plan is for family child care to follow that same trajectory. One of the things that, of course, nobody anticipated was COVID-19, but during the pandemic, we were very, very intentional in also thinking about, just like we're thinking in the grand scheme of things, how do we include family child care? During this time, it was no different. We wanted to make sure that we were able to support and provide resources to family child care providers as well. And here, these are just a couple of the things we were able to do. They were still able to access mental health consultation. And that was for the providers themselves, because again, this was a huge overhaul. They were thinking about, how does this affect me personally? How does this affect my own family? Because they were providing care in their home, but we also heard them having some dilemmas and conflict with, but I know that a lot of the children that I serve, Their families are essential employees, so how can I still be of service? So mental health was a great outlet to just talk through some things with them. Frequent check-ins from the coaches, from mental health consultants, and myself. At least once a week, we were trying to just tag team and making sure we were checking in on our family child care providers. If they were having questions, if there were resources or things we needed to share with them, we were able to do that. As you all know, they were able to be included in the supply distribution. And one of the things that we were really, really excited about was the family child care providers themselves would reach out to us and ask, well, we are finally re-engaged and we enjoy the coaching and we really enjoy the network meetings and the trainings. When are we going to go virtual? And so while we scrambled a little bit to answer that question, they were glad to say, well, can't we use FaceTime? And can we not Zoom? And can we not, is there no way for us to meet? And so while that was something we were thinking about, they were also really, really excited to participate in virtual coaching, trainings, and network meetings. And those have still continued. So lots of lessons learned from our pilot. The pilot operators shared that they learned that just like centers, there's a variety. And when we think about the quality of interactions, where we think about the environmental provisions, when we think about business practices, that's not static. It ranges widely. Again, another piece of information that we were really glad to see was that the overall fall class scores from family child care were similar to those of child care centers when we first introduced class across the state. And then using the quality measurement tools really served as a great place to think about as we work with coaches, as we plan how we're going to support them, and as we think about goal setting and coaching, that information was there for us. And then a big piece is providers expressed that they were interested in continuing participation in a system that could be set up like this. They acknowledge that, Ms. Susan, this is just a pilot, but what if there were a system that were a part of, that we could be a part of, and if there were incentives, we were very frank in saying that, sure, we think that would be great, but let's just be honest, that would mean there would be more regulations, and we would have to think about what that looks like. And to our surprise, a lot of the providers were interested in saying, okay, tell me more, what does that look like? Just like our pilot operators learned lessons, our coaches also realized and reported that the need to be prepared to offer differentiated coaching was really there because, again, like the centers, they saw a wide range in the quality of interactions in thinking about environmental provisions and business practices. So again, they were aware from the pilot that they would be ready to kind of sort of spin on a dime and to meet people where they are. Early on, the coaches did mention that they immediately saw that the coaching that was taking place had an impact on the providers and how they interacted with children. So I know from just working with a couple of the providers, we saw a shift in attitude. We saw some providers who've been doing this work a while. They were tired. They still wanted to do a good job. But when the coaches came in and they worked with them, we saw some new energy. We saw them thinking differently. We saw them asking pertinent questions, and then just really connecting with other people in work that felt really siloed. And then using the quality measurements to, again, really, really provide the coaches with information to really think, because I'm just going to be honest. We wondered, like, what does this look like? Where do we start? Rapport building is so important when it comes to working with family child care providers, because this is their home. But at the same token, really thinking about when we talk about quality and the interactions between children and adults, our quality measurement tools served as a great place to say, okay, hey, this is what you all are doing great. You're wonderful in this area. Hey, this is where we could use a little bit of improvement. Or, hey, we need to learn more about these things. So I really think that the quality measurement tools gave us segues, specific targets, points, and things to talk about. And we really start to develop and are in the process of developing a more comprehensive and common language with our providers as we move through our pilot. So like I said, I'm really happy to announce that we are moving to a year 2 of the pilot. as we think about continuously re-engaging with them, as we think about growing the work that we're doing. We're looking at expanding the pilot to include hopefully a total of 77 participants in 5 different regions. And again, some of the things that we're looking at doing with them is still having them participate in the observations with class and figures, still receiving the one-on-one coaching. Again, we know that with the pandemic, we're trying to figure out, again, could some of that be virtual? But our pilot year 1 has proved that it works, and we're thinking about just keeping moving forward with that. Again, the working with the mental health consultants, it has been a huge request from the providers that they really see the benefits of working with the Family and Child Care Network from their R&Rs that provided. And definitely one of the things that we're looking at is as we got information from the figures and the range of the environments of the providers. So really looking at how can we help them enhance and support their physical settings to really be able to have really good interactions, permanent interactions with their children as they think about their space as well. So again, and one of the incentives again, is to offer pilot participants quarterly stipends. So as we think about growing this work, the question always falls in, what does it look like and what could you do as an R&R? I think I've shared some of these things before. I've had some contact with some of you all, and you've told me like, okay, we want to do these things. So again, these are just a few suggestions in reaching out to the providers that are in your area and just talking to them about, what are things they may need help with? What are some barriers? I think that, again, the supply distribution was a huge point in being able to connect with them to show that, we are concerned about them, and the shift is moving to really include family and child care providers. Inviting them to openly ask questions and to use resources. Just starting out with basically forming relationships and partnerships, just to let them know, hey, we see you, we see the work that you do, we do value you. And if there's anything we can do to help you, just opening that door, because sometimes providers have reported that they do feel siloed, that they do feel kind of sort of left out. And so I think that as R&Rs, you guys in a wonderful position to just let them know that there are resources that could be beneficial, or to even connect. And then the other thing is notifying us if your community is interested in having any type of conversations. We're here to support that. Again, we know that it could be challenging virtually, but we found, like I said, throughout the pilot, that once we get people on board and once providers feel comfortable enough to talk to each other, they've really been interested in it. So thank you all.
Thank you, Susan. I'm going to turn it over to Emmy, who's going to talk to us a little bit about the Leela pilot.
Hey, everybody. I'm so excited to talk to you about the Leaders Academy today. So, as I'm sure you remember, the Leaders Academy was designed to increase the instructional leadership skills of directors of Type 3 centers who are proficient and above. And we just onboarded, thanks Paula, we just selected our next cohort of 60 directors who are launching into this journey, and they come from all across the state. Our year 1 participants from Southeast Louisiana reported a high degree of satisfaction. Of course, there's always room to grow and improve, but we're really excited about this work going forward, and hope that you can help promote this big journey that these directors are going to be on. So we would love your partnership with this, and I'm so excited to see some messages popping up in the chat box from those of you who help lead this work. We would love for you to engage our Leela Fellows as much as possible. So first, celebrate the selected Leela Fellows in your communications. We had a press release go out last week, and I believe on Monday I sent you some promotional language that you could use. We ask you to engage these fellows and think differently about their leadership in your communities. Ask them to talk about the program and share what's working and what's not. And if you're hearing any complaints in those meetings, please feel free to share them with us, because we're always looking to improve the pilot. We ask you to engage Leela Fellows in leadership opportunities in your community. So when you're looking for participants in focus groups or for insight on, particular aspects of the work, we ask you to really think about touching base with these leaders and integrating them into those leadership opportunities. And if you had year one graduates in your community, we ask you to celebrate them. They worked really hard this past year. And, we had very strong participation even despite COVID. And we're really proud of the work that they did. If you have any questions about the Leaders Academy or, as we go, if you want to know more about the curriculum and the work they're doing, I'm always happy to talk about the program with you.
Thank you, Emmy. Now we're going to go on to some of our shared services initiatives.
Thank you.
Mm-hmm.
So as you remember, we were engaged in a lot of shared services initiatives as part of the preschool development grant funds. And so, we have quite a portfolio that's been developing over the course of the last year. The first is that we talked about how we could save money and how directors could save money utilizing state contracts to access reduced rate goods. We had a couple of substitute teaching pilots that launched last year and some of this year. And I believe Karen will be speaking to their experience in that work. We had a business consultation pilot in South Louisiana that incorporated both training and one-on-one consultancy with a partner entity. We developed a bunch of toolboxes to help provide resources to centers to help save their time by, if there's a great example of a particular document, putting it on our website to reduce duplication of effort. And we also ran 2 child and adult care food program pilots where we either helped new directors to learn about the program and shepherd them through the application, or we worked with directors who were either struggling or wanted to re-engage with the program to learn how to more effectively manage it with expanded tools to help make that a little bit smoother. So I'm going to talk to you about a few of these. So as you might remember, we have directors have the opportunity to reduce their costs by accessing state contracts for everyday purchases and large equipment and sort of special purchases. Of course, now we know that centers are spending even more money on daily operations, having new cleaning protocols and PPE requirements just to keep everyone safe. And so I wanted to put this back in front of you today just to underscore and remind you that this is something that's available. We had provided you all with a training on how to use this. I'm not sure your comfort with that. I guess I'd like to get a picture of that. Has anyone tried doing this training, and do you feel comfortable providing a training on this, or is this something where we could help you?
So Emmy, this is Paula. When you had presented at the Teacher Leader Summit, I want to say last year, and you gave us the slides and the information, we had a director's meeting. I want to say it was like closely right after. And so we presented it, and we didn't have a whole lot of participation, I want to say, at that particular director's meeting, but for the directors that was there, really enjoyed that information. And then of course we had, sent the information to all as a follow-up to the centers with the information. And I know there was a few that had actually put in the application to seek out the vendors. And so, but the information that you had provided, it was very easy in order to redeliver.
Great, thanks for sharing that. I would encourage you to kind of maybe brush the dust off a little bit. I see Karen has a question about which centers have been approved for state purchasing. I could certainly get that. It's not something we have right now. We've kind of been just operating on like the number of centers who have been enrolled, and it's just a little bit over 100, which is not a lot. And, I think it's just another thing to do for providers in general. It feels like another set of work to kind of tackle. And I want to figure out how we can make this a little bit easier. So I will, I see a couple of you want that list. So I will get that list of centers.
I think it would help us target them, Emmy, and really help
Yeah,
get them engaged.
of course. I will definitely request that and share that with you. And maybe, you know, it's as simple as like facilitating a conversation when you do have directors meetings to get folks talking about where they're getting their supplies. Thank you, Michelle. So as you can see, we only have 113 centers who have applied. This is, you know, about 20% of the total centers who are able to apply for the cost savings. And so offering trainings again and kind of putting this back in front of folks might be a good idea. They might be thinking a little more about how to save money, having a space for those conversations about who's supplying those PPE. I think that's what Tara was jumping in to say. And then including information in the newsletter. Maybe it's just sort of being a squeaky wheel around our webpage where we try to sort of step out for them exactly how to access these savings. So we really appreciate your help there. I see the comments about the PPE and the cleaning supplies. And maybe we could put that into our newsletter as like a reminder, and maybe it'll trigger some more applicants. Good tip. Thank you. All right, so we also developed some toolboxes. Some of these were developed by our team, and some of these with consultants and vendors, including some of your colleagues here on the line today. We have a director support toolbox, which is meant to be a sort of dashboard to all the types of information that a director might be looking for. And on that toolbox, we have a human resources toolbox, which Agenda for Children helped to develop. And this really lays out the process of recruiting, screening, and hiring new staff, as well as a plan for onboarding new staff. We recognize that we're going to see some workplace shifts post-COVID, and so promoting this particular toolbox, I think, can be very helpful for directors and help them save time and money. We also worked with a vendor who's one of our Leela coaches on the development of an instructional leadership guidebook, which we think is a tremendous resource that really spells out for directors exactly how they can build improvement and strong teams in their programs. It goes from everything from like calendaring functions to thinking about your whole year and mapping out professional development plans with your staff to, you know, helpful forms and resources to use every day. And we would really, we really think the full benefit of this will come from sharing this with your coaches and having them refer to these during their visits, and also sharing them with trainers who can refer to them during other meetings that you host. We do have some more toolboxes coming soon. We appreciate your patience. We'd hope to get these out sooner, but we've had a lot of COVID-related work to do, as I'm sure you're familiar. So just stay tuned. We're always trying to figure out the best resources to make life a little simpler. And with that, I'm going to pass it to Miss Karen Powell, who is one of our very willing partners on the subpool pilot. Thanks, everyone.
Hey, everybody. Good afternoon. I was warned going into the subpool pilot that subpools are a challenge, and it definitely was. It was also very rewarding. So we're excited about what we did accomplish this year. We got to talk, Emmy connected us with several other states who are working on substitute pools, and got to hear from them about some of their successes and challenges as well to inform the work we did. And I am really excited that we created a 3-hour sub or new teacher orientation module. So that's something that we used to train the subs that we recruited, but it's also something that the state is, I believe, still planning to use to make available in an online version, so that when centers have new teachers, this is that critical entry-level information about mandated reporting, activities to do with children, developmentally appropriate expectations, the key licensing regulations to know, all that key starting information that centers are responsible for making sure that their new teachers know, that this would be something they wouldn't have to provide entirely by themselves anymore, or that R&Rs would have to necessarily offer on a regular basis. It would be something that would be available online for anybody to be able to access. So we're very excited about that. We also thought it was pretty important that when substitutes went into centers, that at every center, you know, they have to have site-specific information available to them. And so we thought that would be easiest for a sub to process and comprehend and access if it was in the same format at each center. So we worked with our host child care sites to develop a template that they agreed that this was reasonable, that this was the information that subs would need when they entered the center to work their shift, and that it was something that was as abbreviated and direct and clearly formatted as possible, while still giving those subs everything they need to know about emergency exit procedures, for example. Who's the staff in charge and how do they contact them? Who are the children in that classroom, and does anyone have any allergies or behavioral concerns that the sub should know about? So it's a very short template, but we think that'll really help subs have a good experience, them care more effectively for the children in the classroom they're assigned to that day. And, you know, of course, that the host sites that we started working with are the sites that are more willing to extend themselves and work, but they didn't think that the template was too much or too onerous to put together for a sub coming in for a shift. And of course, some of the documents would be consistent no matter what day or what classroom you were sending a sub to, like information on emergency procedures and information on staff in charge. We also had to create some recruitment documents, and we recruited at a number of different locations. I'll talk about that shortly. And then we created host site agreements and substitute agreements. So we did learn some really key findings. There's definitely a desire by providers for this kind of shared service. And I don't think that'll surprise anybody on this call. You know, we know that some of our centers who either have a stronger financial base or just who understand the necessity to have some flexibility to meet ratios have floaters or have some sort of sub list on hand that they have worked on themselves. But even what we heard from centers who have floaters or who have private sub lists is that it's hard. Those lists change over, and they just don't really have time to go out and recruit anybody themselves. And, you know, even if you don't have high unexpected staff turnover, people get sick, cars don't start, you know, that there are times that they do need subs, or you have teachers going out on maternity leave or other situations. So they were very excited about the possibility of this kind of shared service. But we also found part of our challenge in making more headway this year is that you have to have a dispatch system that the centers can patch into and request a sub, and that notifies the subs of the available shifts. And it's just too time consuming for centers to do that manually themselves by email or text or call, which is why they're so excited about something like this. But it was also too much for us as a coordinating entity to do the same thing. You need something both for those planned absences, but also for those emergency absences. You know, I don't think any of us wants to get entries and requests at 2 and 4 and 5 and 6 in the morning that we have to deal with immediately. So we really, this was our key struggle. This was our key tension point. We explored a lot of different software packages. There aren't that many on the market that are actually designed for substitutes themselves. And so we tried to use different software packages that are used in restaurants and used in gyms and used in other workplaces or used for volunteer shifts. And it was just a little difficult that either the providers didn't want to work with us to adapt them, or that they were willing, but it would be cost prohibitive to get a license. So that is a key learning that we have. One of the other partners who worked on this project actually created an online dispatch system themselves. And so that's what we're really looking at for moving forward. Would we want to put in some investment? And I think Emmy and the state are thinking about that as well. What might we want to do to invest in creating a system that would work for us? That is something that other states have had to do. They've had to create systems themselves as well. They have invited us to use their systems, but those were cost prohibitive as well. We also learned that the sub orientation needs to be available online so that, one, it's more usable for new teachers as well, but two, you don't have to constantly schedule orientations for the subs as you recruit them, because that's just very time consuming to do a 3-hour orientation for 1 or 2 recruited subs at a time. We learned that there is interest to recruit subs at multiple levels in the community. So we recruited both university and college students, but also we worked to recruit older community members such as retirees. And there was really an interest by the centers and by those community groups to participate in something like this. Recruitment of subs will need to be ongoing, and it's really important to keep subs engaged and interested. So even they need to be engaged, I think, not just going out to work shifts, even though obviously they're interested in either gaining experience and or gaining some income. I think it's important because they're not hired by a particular entity, that they do feel like they belong and are part of an entity. And so whether it's the R&Rs or someone else, I think it's really important that we stay connected to our subs, and I think maybe have ongoing professional development where we talk to them about what are challenges you face as a sub, and have them engage with us and each other so that they do feel like they're not going it alone. So that's a quick overview of some of what we accomplished and faced this year.
Thanks, Karen.
Michelle, if I could just sort of bring everybody
Sure.
up to speed super quickly. I know we have a tight schedule today. I just wanted to give everyone an update. I know you all are very interested in this subpool work, and you hear about this problem quite frequently when you're working with centers. So currently we are looking into an automated platform that we hope to build out across the state. This would be something that would likely tie into our existing CCCBC system, which already has our workforce data. So we're working on the design of that particular project, and even with us moving full steam ahead sort of every day working on this problem, it would likely be around October or November before that would be available to the field. We're also looking at how our resource and referral agencies, how we might work with you, and what makes sense with your existing contract, or if we need to, do something different to support the data entry for new folk and the screening and all of the work that Karen just described, to really make that a viable subpool, hosting site for a workforce that we would want working with children every day. And so we're working on these particular things. Shallon Jones, who's new on my team, is focused on this work, and we welcome any thoughts and insights that you might have, or even reactions to what Karen has shared. Karen, we probably will be circling back with you to go a little deeper on some of these lessons that you learned as we work to design this out. Thanks.
And I would like to also add that the new employee orientation is yet to come, hopefully soon for all centers, but we're very excited about. So thank you, Karen.
Yes, Karen, I meant to say that too. I'm so glad you picked that back up. They worked very hard on these online modules that, over the course of the next year are going to become required for any new staff person in the child care center. So that's some great work that'll have a big impact. Coming soon.
Okay, now I'm going to turn it over to Tara. Tara, are you able to join the call? I know you're on the call, but are you able to talk? I know she's in an airport, I believe.
Hi,
Hi,
everybody.
good.
Hi. I actually extended my time in the Twin Cities another day.
Oh,
So,
good. Okay.
hello from Minnesota. I'm going to briefly go over the business admin pilot, as well as the CAC FP pilot. So, if you could go to the next slide, please. Thank you.
Mhm.
All right, so we were tasked with recruiting 20 centers from the GNO area. And as we built the proposal together, we realized in doing a research on just general business administrative needs of childcare centers that a diverse delivery option would be, I think, the most valuable option, in the sense of we wanted to offer centers the opportunity to be trained collectively during group trainings, and then to have that one-on-one business advisory support with a business consultant expert. So that's how we built the pilot. And then one of the outcomes was a toolkit, something that Emmy just referenced, of just different business accounting tools, including marketing strategies that we've compiled together. So the goal was to just expand access to different cost trimming opportunities, to just expand access to general accounting and business tools and processes, and to just overall, figure out how there can be measurable goals so that centers can approach their fiscal year, okay, this is where I am right now, where would I like to be in a year type thing. So we can go to the next slide, please.
Okay.
Thank you. So I just want to highlight a few of these findings from our initial business needs assessment that I thought were pretty interesting. And so we did an initial needs assessment with our 20 centers that we recruited, just to understand where they were financially and what their needs were. And some things that kind of jumped out to us, starting with more centers were operating at a loss in recent years, so in the last year to 2 years, than they were 5 years ago. That's what we found across our pool. About 50% rent and own. Something that I was, that totally surprised me, and maybe it's just like my naiveness in the sector, but the biggest staff benefit that was offered to centers was discounted or tuition-free for staff children. So that was really interesting, because as we know very well, if you have 10 staff and the 10 staff each have a kid, that's 10 spots that could be just totally tuition free. What that led us to realize is that very few centers knew their cost per child. So this was really interesting. And in terms of partnerships with other centers, this also stuck out to us that only 30% were partnering with an organization. So whether that's, with Boys Town, for example, or any other organization where they had a partnership. So that to me says okay, partnership could be increased. Thank you. Mm-hmm. So we delivered 7 group training sessions. We contracted with a childcare expert, Ebony Walker, who provided these 7 sessions. And the one that was most valuable, according to our survey by the participants, was on budget planning. And that also really matched the data that we found in our initial assessment, that there's a lack of access to financial tools, to financial accounting, information. So it wasn't a surprise, and that this was the most valuable session, and we were just glad that we met that need. And then there are tools that you will receive shortly in the business toolkit, or resource kit, if that's what it's called. We partnered with Good Work Network to provide these one-on-one individual sessions. So in total, there were 30, and they're actually still continuing on through July, as due to the pandemic, participation was dropped off, but it has increased. Something that we were really excited to report in our survey is the centers said that by participating in this pilot, they felt much better prepared and situated to handle the PPP and all the different loan and grant programs that became available due to COVID. So they felt that they could navigate, just the trying to rebuild their business. So that to us, we were really excited to hear. All right, last one. So the challenges of their participation, and of course, that was exacerbated by the pandemic. We did convert everything virtually, like all of us have, and it did start to pick back up. Something that it became very clear was just the lack of knowledge on the cost per child, that centers weren't approaching or are not approaching their budget planning, when they sit down for their next year and not looking at that number first. We found that there were some local regulations that that maybe weren't tied to demand for childcare. And recently in the New Orleans area, there's been some new some regulations have been changed that I think might support centers in just opening new facilities. Some things to consider going forward, because we would love to be able for other R&Rs and other organizations to support centers in their business needs. And these are considerations and questions. Staff benefits. The biggest benefit again was the tuition for your discounted tuition, and that's a major cost loss for centers as we know it. However, it might be the only thing centers can provide, and I think it's valuable we unpack that further. If we look at a year's tuition versus a year's cost for healthcare, really how different is that? So that's something to look into more. Childcare staff demographics. This posed the question of okay, well, what percentage of the workforce have children? And is that changing? Will that change now post-pandemic? Cost saving strategies. I was really excited to hear several centers moved from doing payment on a 2-week base salary payroll on a 2-week basis to twice a month. So that cut out two pay periods, and that just previously wasn't considered even an option. And centers implement it with quite ease. And so that was just something like, how can we offer more of those? So I will pause there and see if there's any questions that I can maybe answer or comments. No? Okay.
Move on to the next pilot.
Yeah, all right. I'm trying to keep up with the pace. I hope I'm not going too fast.
No.
Okay, cool. So then we had, as was mentioned, there were 2 CACFP, the food program pilots. And so we had one of those for the regions 1, 3, and 4. So this pilot enabled us to recruit 8 centers to participate. And we partnered with a CACFP expert aficionado, if I may say, Miss Laura Marchand, and she's incredible, and she built this toolkit that we have found dramatically reduces some of the perceived barriers to accessing the food program pilot and using it. So I'll kind of go into what she did and how that happened. So we had 8 centers, and we had a mix of them, some that were on it, some that had never been on it, and some that were on it but then left and wanted to come back. So we had a really good pool. We can go on to the next one. So we did an initial needs assessment just to understand, where folks, where centers were in terms of their CACFP capacity. And this was kind of interesting, and this also ties into what we learned with the business admin pilot. One of the biggest biggest barriers, I should say, was a lot of centers lacked access to Microsoft Office programs, or maybe they had it, but they didn't know how to use it. So there was a knowledge gap. And so that was what the consultant identified as a big issue. Oh, sorry, I'm almost done. A big issue with just the management of all the CACFP documents. So, if your records aren't in order, there's a high risk of not being in compliance with CACFP. the processes. And so that stood out. That I mentioned the record keeping, and then also, which I thought was interesting, the meal service and procedure assessment showed that centers weren't taking advantage of resources that's provided by the CACFP. Like there's different food guides and different tools. And so this helps Laura understand, like, okay, what tools should she create to help centers and to make sure every center has a food guide. All right, we can go to the next, please. So what we delivered, and this is like our findings, I try to kind of did a combo here. I want to focus to something that we observed was in the orientation phase. The food program bases the percent, like the number of publicly funded children is based on the free and reduced lunch program, not CCAP. And what we learned is there's a pretty big gap between the two. The CCAP rates are much lower than free and reduced lunch rates. So that, gave us a lot to think about. And still to this day of just understanding, like, the free and reduced lunch rate perhaps is a more realistic depiction of how families are enduring economic challenges across our state. It's interesting that this food program pilot goes off of the free and reduced lunch rate. And, how can we support centers that are not on the food program, access the food program, and can free and reduce percentage rates, because that data is available for K through 12. Can that inform us on maybe childcare centers that are also eligible? So several things that data point gave us to think about. We also learned that, the food program has a 60-day reimbursement limit. And what we found is that the centers that, really only did, waited till the last minute, that 60-day, that they were more likely to be out of compliance or miss opportunities for reimbursement. So the 30 days seemed to be like that, more the best option in terms of, making sure that you are reimbursing, or that you're being reimbursed for all possible items. So not to wait till last moment. So we also found that the training and guidance that, that Laura provided, which I don't know if Emily will mention more about, how this work is also being converted into a key training module, that with this training and with this toolkit, that a dedicated administrator is not necessary to implement this program well. If you have the training and the tools, then what we found is it can be done from a small center to a large center. And the tools I want to mention, that Laura designed is like shopping guide. And she even designed one for, how do we go through, how do you shop during the pandemic? And so the shopping guide is directly tied to your menu, which is directly tied to your portions. It's just directly tied to your, your cost sheet. So we found that to be super helpful. All right, last slide, please. Thank you. So participation was a challenge, of course, due to COVID. But I will say our consultant Laura was incredible in going to centers even during the peak of the pandemic, was fully masked up, and working with centers who were temporarily closed just to help them be prepared when they were to reopen and to roll out the food program. So lack of access, again, to basic budget and financial tools. So it's like lack of access and like lack of knowledge on how to use these tools. That seems to be, if centers are given both, then I think the food program can function a lot easier for many of them. Some considerations that we just want to mention before we close out. And this is really compiled, through our consultant. There was a waiver extension request made to the USDA during the pandemic. Unfortunately, it was, and this is kind of tricky, but going forward as we still exist in this pandemic, can waiver extensions be submitted in advance? And why this consideration is because several centers did not meet that were not granted that extension and therefore could not meet that 60-day requirement. There was the other recommendation I want to mention is the letter authorizing centers to purchase bulk food, bulk items. The recommendation is that it come from the governor's office as opposed to, I think before it was from, a department lead. That letter, I kept on receiving centers saying that they were being turned down, that letter was not sufficient. It would not allow them to buy in bulk. So the recommendation is perhaps from the governor's office, seal, et cetera. Maybe that would, open the doors more to our centers. The other thing is we were really excited that the review process done by the DNS department has now transitioned virtually. And so the other recommendation is, can potential sponsor orientations also happen virtually? Because right now they're only offered on a quarterly basis. And so if they can be done virtually, perhaps more centers can join the program. So I'll stop there and see if there's any questions or comments. And I saw, Karen is asking, can we replicate the business trainings in our area? Are these materials available to share? And I'll pause and see if Emmy, if you have any updates on that or.
Yeah, thanks. We are really looking at launching, in terms of the business strategies, a much more comprehensive approach as a department over the next few months. So one is, I believe many of you participated in the ECTA's Strengthening Business Trainings, or Strengthening Business Practices training of trainers. And so we are going to be offering that training, which I think some of Ebony's content pulled from that, through our department. And that'll be a webinar series that'll sort of follow a sequential flow that we'll make available online. And of course, we'll record those and have, a library of those trainings. I don't know how many people go back and actually listen to recorded webinars, but we will want to make that as available as possible. And we're also going to be working with First Children's Finance, which I believe there's a slide. I don't know if it's the next one or not, Michelle. If not,
Yep.
It's coming soon. Yeah,
Here
there
it
we
is.
go. So we are going to be working with First Children's Finance, which is a national entity that really works on providing financial and business development assistance to childcare businesses. And they're going to be working with us at the department to really help us think through what a system of supports in terms of business practices might look like for centers. And they're also going to be working with you and making themselves available to you as a resource and as a consultant to look at what you make available through your resource and referral agency, where you find barriers, and how we can be of a better support to you to do this work. So those are a couple things that are in the pipeline, and I'm anticipating that our work with First Children's Finance is going to result in a comprehensive strategy that we'll be rolling out, in 2021. So that's my update there. I don't know if there are other questions. I'm happy to answer what I can.
Okay, now I'd like to turn it over to Antonia. Antonia, are you on the line still?
Yes, I'm still here.
Okay. We are partnering with LDH. We started this partnership last year and are expanding the partnership this year. And she's going to talk a little bit about some of the things they are doing that you may be involved in.
All right, good afternoon, everyone. Like Michelle said, we have partnered with the Department of Education, and I'm excited to talk about some of the things that LDH and Well Ahead Louisiana, some of the opportunities that we have available to support early care and education for a healthier start. And I'm excited to hear about some of the pilot programs that are going on, because we also have additional trainings, tools, and resources that we can provide for providers as well as the early childhood coaches. So I've met some of you, but for those of you that I've not met, my name is Antonia Johnson, and I work with Well Ahead Louisiana, and my role is the early childhood manager. And in my role, I lead all efforts to implement child obesity prevention practices into early care and education in our state. Prior to this role, I worked for an early childhood ancillary certificate program as a coach, where I help teachers to get their ancillary certificate in CDA. I also work with Head Start prior to that as an advisor for teachers. And I was also a pre-K, kindergarten, and second grade teacher in Jefferson Parish Public Schools. So that's a little bit about me and my background and what I've done in early childhood. So just a little bit about what Well Ahead Louisiana is. So Well Ahead Louisiana is an initiative that was started by the Louisiana Department of Health in 2014. And the aim of Well Ahead is to improve the health and wellness of all the residents in our state. And we look to support the health and wellness of our residents by promoting health and wellness practices in the places that we live, work, and play. And we do this by connecting residents in the community with resources that they can use to help them to implement healthier practices. And for early care and education, we're looking to support obesity prevention practices through improving child nutrition practices, supporting infant feeding and breastfeeding, talking about the amount of physical activity that children should be engaged in based on their age, how we can reduce obesity and disparities. And I've heard a lot today about how we're working to improve the interactions between children and how they learn. And we want to make sure that we're looking at the whole child, because children can't learn and can't be engaged if they're not fed nutritionally properly and if they're not given the right amount of physical activity. So we're looking to provide you with that layer so the coaches can add that to their toolbox. So how we're looking to partner with the child care resource and referral agencies, we know that this partnership is crucial because you work so closely with the child care providers. Let's see. Oh, well, I see that Paul is asking about a training. We have a training. I'm not sure if you're talking about the one that's coming up on this coming month, next Tuesday, July 14th. That one is full.
The Go Knapsack?
The knapsack training, those are monthly. I'll talk about those in a little. So working with the R&Rs is important for us because you already have the close relationship with the centers. So we just want to provide additional tools and resources that you can work with the child care providers with. Some of our goals is working to increase well spot designation, and I'll go into a little more detail about what well spot designation is, as well as the number of centers that are participating in Go Knapsack, coaches that are trained to help centers and guide them through using Knapsack. And Knapsack will help providers and coaches in their knowledge base of what best practices are around health. So these are some of the programs that we have available. I mentioned the Well Spot Designation Program. So that's the statewide recognition program that Well Ahead Louisiana is known for. So we work with all organizations from K-12 schools, universities, hospitals, restaurants, but we're focusing, of course, in my role, I work with how we can get childcare centers to become childcare well spots. So this is something that will be done voluntarily by childcare centers. We know that we're always looking for ways to help them improve the quality of the care that they're providing. So we also want to look at the child's health. So we have regional representatives throughout the state that will go into the child care center and help the directors or the owners look at which areas they want to make the improvements in. And those healthy changes at Well Ahead, we call those wellness benchmarks. An example of a wellness benchmark that child care centers can implement is creating a tobacco-free policy. And they can help them to create that. They can also talk to them about how they can become a breastfeeding friendly workplace for their employees, as well as parents who are breastfeeding. They can walk them through that process, implementing an oral health program, increasing their practice and improving their practices around their outdoor play and learning centers, the amount of physical activity. There's just a wealth of areas that our regional representatives help child care centers with in becoming a well spot. Now, we also have an intervention program that centers can use as well. The platform is dual based. So there's resources and tools for providers, and there's also tools and resources that coaches can use to support and help the child care providers. So a little bit about Go Knapsack. It is an online platform, and it has a suite of tools and resources that providers and coaches can use to increase their knowledge based on what obesity prevention practices are. When a child care provider thinks about changes that they want to make, sometimes that can be overwhelming to think about all of the areas that you want to make improvements in. So what Go Knapsack has done, they've organized their platform into 7 different areas, and they're called learning modules. So the child care provider would choose a section that they will be interested in. So they vary from child nutrition, breastfeeding and infant feeding, infant and child physical activity, outdoor play and learning, screen time, oral health, and form to ECE. And the way that Go Knapsack is set up, the child care provider starts off by taking a self-assessment. And once they take a self-assessment, they see what areas their strengths are in, and then where their areas for improvement is. And based on that report that they receive after completing that self-assessment, then they go ahead and they decide which area they want to work in. They create a goal. Go Knapsack has a tool where they can create an action plan, and they provide them with detailed steps to put their action plan into place. They have activities, there are lesson plans, there are trainings, there are multiple resources that the providers can use to improve in those practices. Now, and the key to this is having the early childhood coaches to support and guide and really show the providers how to use Go Knapsack. And the way that the coaches would support the child care providers is they have to take an online consultant tools training. And that's a 2-part training. Each training is 90 minutes long. Go Knapsack offers it monthly and it's virtual, and it's no cost for that. So that's a little bit about the intervention programs that is supporting centers as well as coaches. And then we also have an incentive program that Michelle talked about a little earlier, and it's called Let's Be Healthy. And this is a grant opportunity that the Department of Health and LGOE has partnered together to provide childcare centers with the funds and the resources needed to make those changes. Because we know a lot of time in centers, they don't always have the funds to make the changes and do the different things that they would like to change around their childcare center. So how Let's Be Healthy is set up, in order to be eligible, they have to be in some of the pilot programs that we talked about today. So they have to participate in the CACFP pilot with Agenda for Children or Northwestern State University. They can also be in the CACFP pilot with the Family Child Care Centers, or they can be a Cohort 1 Leela Fellow. And they also have to participate in CACFP. So if they are in any of those pilot programs, the application to participate in Let's Be Healthy, it opens August 14th and it closes September 14th. And you can contact myself, Michelle, Emmy, or Susan to get more information about that and how it works. But each center will be paired with a technical assistance consultant, and they will walk them and guide them through completing one module in Go Knapsack. And those centers will each receive $1,000 to implement any of those healthy practices that they want to implement from Go Knapsack. So for coaches, as I mentioned before, they also have the tool of Go Knapsack. It's the online suite that has the tools and the resources for the coaches to use. They have to invite childcare centers. They can't just log in to Go Knapsack. They have to be invited to join Go Knapsack because they really need a lot of guidance and support in using it, because Go Knapsack can really be overwhelming because it has so many tools and resources. So if you're not aware of the best way to use it, you can be overwhelmed and not use it correctly. So that's why it's set up in a way where they have to be invited by a consultant that's trained to use the platform. So our goal is that some of the early childhood coaches throughout the region, that they become consultants, so that can be another tool that they can use when they go into the centers and support them. And we're also going to have a professional development opportunity that we're calling the Healthy ECE Academy. And it's going to be in a TOT model, where we're going to have an opportunity for 30 early childhood coaches to receive a full day training around obesity prevention practices. And from participating in their training, all of those coaches will receive the PowerPoint as well as training materials. And the goal is for them to re-deliver those trainings to providers. Now, we would like to work with the R&R so they can tell us who will be the best individuals to complete this training. Our goal is to have individuals trained throughout the state. So I think there are 6 R&R. So our goal will be to have about 5 coaches from each R&R to attend this training. So we will have individuals throughout the state that are trained on obesity prevention. And you guys can guide me and let me know who will be the best persons to attend that training. And you can go to the next one. So the benefits of some of the programs that Well Ahead offers: with the WellSpot designation program, we want the child care centers to improve their practices. So with WellSpot designation, there's a regional representative that helps them. They will have access to Go Knapsack because the Well Ahead Louisiana regional representatives that support child care centers in becoming WellSpots, they're also trained on Go Knapsack, and they invite them to join Go Knapsack. And if the child care centers are improving their practices, then we have healthier children. The benefit for the coaches is they have centers that are already looking to make changes, and they will have access to Go Knapsack, and they will be in a mind frame where they're open to make those changes. The benefit of Go Knapsack is just, it gives an access to a wealth of materials and resources and lesson plans, even online trainings that the centers can use and the coaches can use as well. And coaches are able to view, once they invite their centers to join Go Knapsack, they can follow and track centers with the self-assessments that they have completed, the action plans. As they check their goals off, the coaches can see everything that their center is doing. So they're able to better support them and guide them through the process. And of course, Let's Be Healthy helps the centers because they are given the resources they need to make those changes, and they're provided with a consultant to help them. Let's
There's
see.
a question, Antonia. If their coaches do the trainer for this and we offer these trainings, will it be counted as a deliverable? Oh, for group training? Is that what you're talking about, Amy?
Are you talking about, is she talking about the
Oh,
healthy?
she's talking about if they do the trainer for this and they offer it, can they count it on their billing? Yes.
Yes, they can. Were there any other questions around that? Okay, we can go to the next one.
Okay.
So if you're interested in any of the programs that we talked about today, whether it's Go Knapsack or WellSpot designation, you can request a follow-up orientation where I can just walk you through the Go Knapsack platform and show you how providers as well as coaches use Go Knapsack, just so you can get a better understanding of it. If you wanted me to talk to your coaches about it, I'll be more than willing to help you with that. And our regional representatives, they can provide an orientation on WellSpot designation. And yes, family child care centers, all child care centers are able to use Go Knapsack as well as become a WellSpot. So it's for child care centers, family child, all child care centers are eligible for it. And if you want any printed materials that from what we spoke about today from Go Knapsack, Let's Be Healthy, or a WellSpot designation, on the next slide, my information is there, my email, and as well as my work number. So here's my email, and I believe the PowerPoint slides are going to be given to everyone. So my information will be there, and the slide before this one, there were additional links as well. So I know that was a lot of information. So if you guys have any questions or comments, I'll be more than happy to answer them. If not, thank you for the opportunity to talk to you about what Well Ahead Louisiana has available.
Thank you, Antonia. We look forward to your partnership.
Thank you.
Okay, the respite care reflection. Emmy, did you want to talk about this?
I sure can. Thank you,
Okay.
Michelle. You've certainly done a lot of talking today. Michelle has been webinar after webinar. We need to get you some throat lozenges next time I see you. So we have developed a short survey where we want to gather your insights into how you're reflecting on the respite care that was offered most recently. I don't really want to say post-COVID. We're still kind of, in the midst of this and trying to figure it out. But with more centers opening, I think we have an opportunity to really think about what we offered and what worked and what didn't work, and what adjustments you're thinking about for future emergency responses. This is meant to be thoughtful, but it's not meant to be super time consuming. So I ask you to maybe have the person in your agency who was most closely tied to the work and who can offer like a high level overview of the key changes you want to make, complete this survey. And we're asking you to complete it by next Thursday, which I know is a tight turnaround. Specifically, there's another set of questions that are in the survey that are information gathering on how many people are on your staff. And we need that data kind of quickly as we work on building out our database system. So rather than pepper you with several requests, we included that at the top of that survey just to kind of have it all in one place. So we really appreciate your cooperation in getting that completed as soon as you're able. Thank you.
Okay, for upcoming events, I did send out an invitation to you to forward on to your coaches. Please forward it on. We are offering a free ASQ training. You have to register through Eventbrite. So please have them register. It's from 10 to 4, one day during those 4 days. So they would need to be available for one of those days. And then after that, they'll be given specific instructions as how to obtain a kit. So please, if you can, have someone from your agency attend those. It's 2 slots per agency is the question. Yes, 2 slots per agency. Right now, currently, there are plenty of openings. So if you need an additional opening, please send me an email because some of your regions are very big and have quite a few centers that may need this training. So if you feel like you need to send an additional trainer, please let me know and I will work with Britt to get your trainer registered. We have a check-in call on August 12th from 1 to 2:30. And in this call, we will be joined by Dr. Booth and Dr. Keys, who will be talking to us about the enhanced mental health services and some of the outcomes that they saw from last year's mental health visits and the telemental health that was offered. And I'm really excited to share that information with you. We get a report every month and every year with a total statewide report, and I find it very interesting, and I think you all will be very excited to see what our mental health consultants are doing throughout the state. So we welcome that call next week or next month on August 12th. We hope you all can join us. You will be getting some invitations, not to pepper you with lots of things, but as you know, with our upcoming trainings, we are looking at curriculum training. We are looking at First Children's Finance. We're looking at quite a few things as far as training and development for you and your staff. So, join us when you can. If you can't, and we can record it, we'll make sure we send you the recording. We're in the process of getting your Google Drives set up. I believe Farishay has emailed you, and I'm going to be setting up calls with you sometime next week whenever you're available, so that we can review the Google folders and make sure you have access to everything that you need, including these trainings that are being recorded, so that if you can't make it to one of these trainings, you can go back and watch it, because we don't want you to miss out on any really important information, because we are moving things very quickly, and we do apologize, but we just need to keep things going in this time of COVID to make sure that our centers and our teachers and our coaches and you are well supported to begin the 2020-21 school year. Did anybody have any outstanding questions that I can help you with today, or any members of our team that are on this call?
Hi, Michelle, it's Tara. Quick question. So the presentation will be shared with us. Is that on our new folder? Is that right? Or does it go under the updates in our former Google page?
That's a very good question. You will have a folder for just training materials. And when we talk with you this week, we will go over where that is and how you will find it. So I look forward to that. I am going to be sending out this PowerPoint to you without the recording for those of you that want it, and all the links that are in it today.
Okay, great. Thank you.
Are there any other questions? Well, if no, thank you very much for your time today, and we hope you have a wonderful weekend. And I promise that there'll be no more Friday afternoon CCR and R meetings. That I did my best to try to schedule this one in before everybody's vacations. So enjoy your vacations coming up. And I hope you enjoyed getting an update on all of our pilots and upcoming tasks that we are working on for this year. So thank you again, and have a great weekend.